If you are a man over 60 and you have noticed that your energy feels different than it used to, that getting up at night has become more frequent, or that you feel like something is just not quite right down there, I want you to listen closely because what I am about to share with you could change everything. These changes you are experiencing are not just inevitable parts of aging. They are warning signals that your prostate is under attack from habits you probably do not even realize are causing harm. My name is Dr. Ethan Blake, and I have spent over 15 years as a urologist helping men navigate the complex changes that happen after 60. What I have discovered in my practice, working with thousands of men just like you, is that prostate inflammation and enlargement are not random occurrences. They are predictable responses to specific daily patterns that most men fall into without ever knowing the damage they are causing. Here is something that might surprise you. The four habits I am going to reveal today are so common, so seemingly harmless, that when I first mention them to my patients, they often look at me with confusion. They say, Dr. Blake, are you telling me that this simple thing I do every day is actually hurting my prostate? And the answer is yes. These quiet, everyday choices create a perfect storm of inflammation, pressure, and irritation that slowly but surely transforms a healthy prostate into an enlarged, uncomfortable burden. But here's the powerful truth I want you to understand right from the start. Your prostate is not broken beyond repair. It is not destined to cause you misery for the rest of your life. What it is doing right now is responding to the environment you have unknowingly created for it. And when you change that environment, when you remove these inflammatory triggers, your prostate can begin to heal, shrink back toward normal size, and give you back the comfort and confidence you thought were gone forever. In this video, I'm going to walk you through these four devastating habits that are quietly inflaming your prostate every single day. I will explain exactly why each one is so damaging, how it creates the cascade of problems you are experiencing, and most importantly, what you can do starting today to reverse the damage. These are not complex medical procedures or expensive treatments. They are simple shifts in your daily routine that cost nothing, but can give you back years of comfort and peace of mind. Now, before we dive into these habits, let me tell you why this matters so much more than you might realize. When your prostate becomes inflamed and enlarged, it does not just affect your bathroom habits. It affects your sleep, which impacts your energy during the day. It affects your confidence, which changes how you interact with your family and friends. It affects your sense of masculinity and vitality, which touches every aspect of how you feel about yourself as a man. I have seen patients in their 60s, 70s, and even 80s who thought their best days were behind them completely transform their quality of life by addressing these four simple habits. Men who were getting up 5 or 6 times a night suddenly sleeping through until morning. Men who felt weak and tired all day suddenly having energy to play with their grandchildren, work in their gardens, and enjoy their retirement years. Men who had resigned themselves to a life of discomfort, discovering that strength and vitality were still very much within their reach. What makes these habits so dangerous is not just what they do to your prostate directly, but how they create a domino effect throughout your entire system. When your prostate becomes inflamed, it triggers changes in your hormone levels, your sleep patterns, your circulation, and even your mental clarity. It is like a pebble thrown into a still pond. The ripples spread far beyond the initial point of impact, affecting areas of your health and well-being that seem completely unrelated. The first habit I am going to reveal is something that probably 90% of men over 60 do multiple times every single day without giving it a second thought. In fact, you have probably done it already today, maybe even within the last hour. When I first explain this to my patients, they are often shocked because it seems so innocent, so normal, so much a part of everyday life that the idea it could be harmful feels almost impossible to believe. But here's what happens inside your body when you engage in this habit. Your prostate, which sits right at the base of your bladder, surrounding your urethra like a soft collar, begins to experience a specific type of pressure and irritation. This pressure is not dramatic or painful at first. It is subtle, almost unnoticeable. But day after day, week after week, month after month, this gentle but persistent irritation creates microscopic changes in the prostate tissue. the cells begin to respond to this chronic irritation by producing inflammatory compounds. These compounds are your body's attempt to protect and heal the tissue. But when the irritation never stops, the inflammation becomes chronic. And chronic inflammation in the prostate leads to swelling, enlargement, and all the uncomfortable symptoms you have been experiencing. Think of it like this. Imagine you had a small pebble in your shoe, so small you barely noticed it at first. You could walk around all day with that pebble, causing just the slightest irritation with each step. But after walking thousands of steps over many days, that tiny irritation would create a blister, then soreness, then real pain. Your prostate responds to this first habit in exactly the same way. The irritation seems minor, but the cumulative effect over months and years is devastating. What makes this habit even more problematic is that as your prostate becomes more inflamed and enlarged, it actually makes the habit worse. The enlarged prostate creates more pressure and discomfort, which leads you to engage in the habit even more frequently, which creates more inflammation, which enlarges the prostate further. It becomes a vicious cycle that feeds on itself, getting worse and worse over time. The good news is that once you recognize this habit and understand why it is so harmful, breaking the cycle is surprisingly straightforward. It does not require willpower or discipline or major lifestyle changes. It simply requires awareness and a few small adjustments to how you approach certain everyday situations. But before I reveal what this first habit is, I want to prepare you for something important. When I share these 4 habits with you, you might feel a moment of frustration or even anger. You might think, why did no one ever tell me this before? Why have I been unknowingly damaging my prostate for years when the solution was so simple? That frustration is completely understandable, but I want you to channel it into motivation rather than regret. The truth is, most doctors, even urologists, focus primarily on treating prostate problems after they have already developed rather than preventing them in the first place. The medical system is designed to diagnose and treat disease, not to educate men about the daily habits that create disease. That is why so many men suffer unnecessarily for years before finding the relief they desperately need. But you are here now, learning this information, and that means you have the power to change your trajectory starting today. Every day you continue with these harmful habits is another day of unnecessary inflammation and enlargement. But every day you implement the changes I am about to share is another day your prostate can begin to heal and return to a healthier state. The men who see the most dramatic improvements are not necessarily the ones with the mildest symptoms or the youngest patients. They are the ones who take this information seriously and implement it consistently. They understand that their prostate health is not something that happens to them, but something they have significant control over through their daily choices. So let me ask you this. Are you ready to learn what these 4 habits are? Are you ready to understand why they are so damaging and what you can do instead? Are you ready to take back control of your prostate health and reclaim the comfort, energy, and confidence that should be yours in these golden years? Because once you see these habits clearly, once you understand the simple science behind why they are so harmful, you will never look at your daily routine the same way again. The first habit that is silently destroying your prostate every single day is something so common, so automatic, that most men do it without any conscious thought whatsoever. It is the habit of chronic dehydration combined with drinking the wrong fluids at the wrong times. Now, before you dismiss this as too simple to matter, let me explain exactly what happens inside your body when you fall into this pattern. Most men over 60 have developed a fear of drinking too much water, especially later in the day because they are worried about getting up at night. So what do they do instead? They sip coffee throughout the morning, maybe have a soda with lunch, perhaps a beer in the evening, and they convince themselves they are staying hydrated. But here's the devastating truth. These beverages are not just failing to hydrate you properly, they are actively dehydrating your system, while simultaneously irritating your prostate. Coffee, sodas, alcohol, and even many teas contain compounds that act as diuretics, forcing your kidneys to pull water from your tissues and flush it out of your system. But they also contain acids, sugars, and artificial chemicals that create inflammation throughout your urinary tract. Your prostate, sitting right in the middle of this system, becomes a target for this chemical irritation day after day. When your body is chronically dehydrated, your urine becomes concentrated and acidic. This concentrated acidic urine has to pass directly through your prostate every time you urinate. Imagine pouring lemon juice over an open wound repeatedly throughout the day. That is essentially what concentrated acidic urine does to inflamed prostate tissue. It burns, it irritates, and it triggers more inflammation with every single trip to the bathroom. But the dehydration creates another problem that most men never connect to their prostate issues. When your body lacks adequate water, your blood becomes thicker and more sluggish. This thick blood has trouble flowing through the tiny capillaries that feed your prostate tissue. Without proper blood flow, your prostate cannot receive the oxygen and nutrients it needs to stay healthy, and it cannot efficiently remove the waste products and inflammatory compounds that build up in the tissue. This creates a perfect storm of inflammation. Your prostate is being constantly irritated by acidic urine, starved of the nutrients it needs to heal, and flooded with inflammatory waste products that cannot be properly cleared away. No wonder it becomes swollen, enlarged, and painful. The second habit is just as common and just as destructive, but it happens primarily in the evening hours when most men are trying to relax and unwind. It is the habit of sitting in soft, cushioned chairs or recliners for hours at a time, especially after dinner. Again, this seems completely harmless, even beneficial. After a long day, you deserve to sit comfortably and rest, right? But here's what happens to your prostate when you sink into that soft chair or recliner for hours. The cushioned surface creates pressure points that compress the blood vessels and nerves that supply your pelvic region. Unlike a firm surface that distributes your weight evenly, soft cushions create areas of concentrated pressure that restrict circulation to your prostate and surrounding tissues. When you sit in a soft chair, your pelvis tilts backward and your tailbone sinks deep into the cushion. This position compresses the perineum, the area between your scrotum and anus, where many of the blood vessels and nerves that supply the prostate are located. The longer you sit in this position, the more compressed these vital pathways become. Poor circulation to the prostate has devastating effects that compound over time. Without adequate blood flow, the prostate tissue becomes starved of oxygen. Oxygen-starved tissue becomes inflamed and begins to swell as it tries to capture whatever oxygen it can from the limited blood supply. This swelling further restricts blood flow, creating another vicious cycle that feeds on itself. But the problems go deeper than just poor circulation. When you sit in a soft chair for hours, your core muscles, including the muscles of your pelvic floor, become weak and inactive. These muscles play a crucial role in supporting your prostate and maintaining healthy urinary function. When they become weak from hours of inactivity, they can no longer provide the proper support and pressure regulation your prostate needs. Weak pelvic floor muscles also contribute to incomplete bladder emptying, which means urine sits stagnant in your bladder longer than it should. This stagnant urine becomes a breeding ground for bacteria and creates additional pressure on your already inflamed prostate. The combination of poor circulation, weak muscles, and stagnant urine creates an environment where prostate inflammation thrives. The third habit is something that happens primarily at night, and it is directly connected to the sleeping position you have probably been using for decades without realizing the damage it causes. Most men over 60 sleep either on their stomach or on their side, with their knees pulled up toward their chest. These positions feel comfortable and natural, especially if you have back pain or other age-related aches and pains. But both of these sleeping positions create sustained pressure on your prostate throughout the night. When you sleep on your stomach, your full body weight presses down on your pelvic region for 6 to 8 hours straight. This constant pressure compresses the prostate and restricts the natural circulation that should be occurring during sleep to help heal and restore the tissue. When you sleep on your side with your knees pulled up, you create a different but equally damaging type of pressure. This position compresses the blood vessels in your groin and pelvis, creating a tourniquet effect that restricts blood flow to your prostate for hours at a time. Your prostate, which should be receiving increased blood flow during sleep to facilitate healing and waste removal, instead becomes starved of circulation right when it needs it most. Sleep should be your prostate's time to heal and recover from the stresses of the day. During deep sleep, your body increases blood flow to damaged tissues, releases growth hormones that promote healing, and activates the lymphatic system to clear away inflammatory waste products. But when your sleeping position compresses your prostate and restricts circulation, these healing processes cannot occur effectively. Instead of waking up with a refreshed, restored prostate, you wake up with tissue that has been compressed and starved of circulation all night long. This sets you up for increased inflammation and discomfort throughout the following day, creating a cycle where your prostate never gets the opportunity to properly heal and recover. The fourth and final habit is perhaps the most surprising because it involves something that most men consider healthy and beneficial. It is the habit of taking long, hot showers or baths, especially in the evening before bed. Hot water feels wonderful on tired muscles and joints, and many men use hot showers or baths as a way to relax and unwind after a stressful day. But prolonged exposure to hot water creates a specific type of stress on your prostate that most men never consider. Heat causes all the tissues in your pelvic region to swell and become engorged with blood. While this might seem like it would improve circulation to your prostate, it actually has the opposite effect. When the tissues surrounding your prostate become swollen from heat exposure, they compress the prostate from all sides, creating pressure that restricts its natural function. This is similar to what happens when you get a burn and the surrounding tissue becomes swollen and tight. The swelling that heat creates in your pelvic tissues puts a squeeze on your prostate that can last for hours after you step out of the shower or bath. These four habits work together to create a perfect storm of prostate inflammation that gets worse over time. Each habit on its own might cause manageable irritation, but when combined, they create a level of chronic inflammation that overwhelms your prostate's ability to heal and maintain normal function. But here is the hope I want you to hold on to. Every single one of these habits can be modified or eliminated completely, and when you do, your prostate will begin to respond almost immediately.